For decades, governments in Europe and around the world have waged a war on drugs.
In order to fight and defeat this enemy, it is necessary to wage a new all-out offensive.
With one exception. 24 years ago, one country decided to decriminalize drugs, all of them, by treating drug users not like criminals, but patients. Here's how Portugal quit the war on drugs.
Normally in the streets we take out these kits. This is an injection kit. After the change of the law, there's a lot of helping happening in the streets, like outreach teams, and you can feel it's more secure because you're not a criminal anymore. So I can get help without get beaten. It's very safe now. Sometimes this kind of job, the people, the community don't understand, because it looks like we are promoting the use of drugs.
The Portuguese law of 2001 rests on the idea that eradicating all drugs is an impossible goal.
Because people were always going to be doing drugs no matter what prohibitions or what restrictions were put into place, a smarter way of dealing with that would be to just treat people like adults and say, okay, people are going to use drugs. What can we do as a society to ensure the health and safety of our society?
Portugal adopted an approach focused on public health rather than public order. They eliminated all criminal charges for the use, acquisition and possession of all drugs, with no distinction between hard and soft ones, as long as the quantity isn't more than what an average individual would use in 10 days. To be clear, this doesn't make drugs legal. Being found with them is similar to being caught driving without the seatbelt on. It's illegal, but it's not a criminal offense.
And what Portugal really did was they decided that it would be a much more rational approach to shift responsibility for drug policy from the criminal justice system to healthcare.
Dealing remains a criminal offense, marking the distinction between the dealer, a criminal, and the user, a patient in need of care.
So my name is Nuno Maneta and I'm 52 years old and I work in Crescer for 3 years already.
Andrea Alves, I'm coordinator here at Crescer and I have 31 years old.
I'm a peer worker because I used to use drugs. We are going to the warehouse to pick up some food that the mayor's office normally give us to give the guys in the streets. Hello. Nuno. E em termos de cabecinha, não ficas tão sozinho aqui na rua. Eu sei que eles são bons camaradas. One of those guys was saying, I'm in a good spot. I'm doing the life I always dream. I said that in my times. There was some years I used to say that when somebody tried to help me. I was fooling myself, but it was because I didn't realize that there's more in life, there's more good opportunities than the ones I ever know. When the opportunity came and I started dreaming, everything changed.
In order to support people going through active addiction, Portugal created dissuasion committees, panels seeking to dissuade people from using drugs rather than punishing them.
And the interesting thing about Portugal is that all of these services are voluntary. No one is forced to do anything.
Dissuasion committees are panels made of a psychologist, a social worker and a lawyer, having to assess the level of addiction and risk. They can then offer a course of therapeutic treatment, they can impose fines or sanctions, and can refer the person to health structures.
People are not guilty for using a substance. I choose when I use alcohol or when I use tobacco or when I use coffee. People can choose when they use cocaine, heroine, everything, but with support and with information for people make the best choices in their lives. Toma. Mais? Dou-te os que quiseres. Queres marcar para amanhã?
Quero.
Ok, então amanhã à tarde aqui?
Sim, senhora.
Pronto, está combinado. Amanhã à tarde aqui, ok?
Tá bem, então vá.
Tchau, tchau, adeus.
I experienced a time that the point of view was different. I get beaten for the police in the 90s. The police stole my drugs and throw it in the floor. And I get hungry in those times. I get afraid of those guys.
To grasp how Portugal even managed to pass a law like this, we have to understand the depth of the crisis it was going through. Back in the 1960s, while most European democracies were undergoing cultural and social change, Portugal was kept isolated under the Salazar dictatorship. His rule, which lasted almost 4 decades, made Portugal one of Europe's longest authoritarian regimes. While Salazar was replaced in 1968, his regime, the Estado Novo, was only overthrown in 1974 with the Carnation Revolution. This coincided with the start of a severe economic depression. As Portugal was grappling with its newfound freedoms, in the early 80s, heroin started flooding the European continent and found Portugal unprepared. By the 1990s, an estimated 1% of the population was addicted to heroin, contributing to one of the worst HIV epidemics in the European continent.
Something had to be done. Putting people in jail, telling people that they can't use drugs, and prohibiting them from using it, these kinds of very classic ways of trying to deal with drug problems in most societies, was untenable and wasn't working. It was a critical situation in Portugal, and I think they were a little more willing to try a more dramatic measure.
Cool, but you might be asking yourself, how does Portugal pay for it? A 2015 study found that this law actually saved the country some money. The social cost of drug use fell by 18% in the first 10 years of the policy. This is particularly linked with a significant reduction in the costs associated with criminal proceedings, showing that addiction treatment is much less expensive than imprisonment. Of course, there were a few bumps on the road.
Portugal, when the policy was initiated, was in better financial straits than 10 years later when the global financial crisis hit. And this actually had an impact on the policy.
Portugal has had to heavily rely on civil society organizations and non-profits to keep up all of the support work it does in its communities. Crescer is an example of that, and so is GATT, an NGO focused on helping people with hepatitis, HIV and AIDS, and it's also responsible for opening the first supervised consumption room in Portugal.
Eu acho que esta sala é um pouco diferente, porque é uma sala que é liderada por pares, por pessoas que tiveram elas próprias uma experiência de consumo. É um modelo menos medicalizado e mais comunitário. Claro que esta equipa de pares que gera a sala conta com o apoio dos médicos e enfermeiros e um sítio que é muito confortável para quem usa drogas, porque é um sítio onde as pessoas não são discriminadas, podem falar abertamente sobre o consumo de drogas, podem ter material, podem ter educação, podem falar com os seus pares, não é? Com pessoas que estão na equipa e que são pares.
Chamo-me João Santa Maria, tenho 54 anos. A minha função aqui no Moraria é a responsável das salas de consumo. E então, quando comecei a trabalhar aqui, disseram-me que eu ia ter um trabalho de par, eu nem sabia muito bem o que era ser par. Depois, ao longo dos anos, percebi que, afinal, par foi a minha vida toda, podes traduzir. Aqui tem um espaço tranquilo, seguro, onde podem receber alguma educação para o consumo, porque as pessoas que consomem drogas injetadas não são enfermeiros nem médicos e, portanto, aprenderam a consumir drogas injetadas com alguém que não sabia consumir e, portanto, aqui é um sítio onde as pessoas realmente podem vir buscar informação e formas mais seguras de consumirem drogas. Há uma frase que agora até passou a ser muito usada, mas que eu aprendi em Narcóticos Anónimos, é nada sobre nós sem nós. E, portanto, fazerem algo que nós não estejamos presentes e que nós também não possamos opinar, acho que não faz assim grande sentido, pelo menos para mim.
In the 24 years since its passing, the Portuguese approach has become a model, and for good reason. Drug-related deaths, originally comparable to the EU average, have since plummeted, but they increased across the rest of Europe in the same time frame. In 2001, Portuguese people who used drugs accounted for 50% of new HIV diagnoses in Europe. By 2019, this number had decreased to 1.68%. This also had an effect on the country's prison population. The percentage of sentences for drug addiction went from 40 to 15% in less than 2 decades.
Se a pessoa estiver a viver na rua, não tiver apoio e for muito discriminada pela sociedade, o seu uso de drogas vai se tornar bastante mais arriscado. Mas se a pessoa tiver o uso de drogas integrado na sua vida, se conseguir falar sobre isso sem ser discriminada ou julgada, nós pensamos que dessa maneira a pessoa vai ter muito menor risco.
So why isn't the world copying them? In the American state of Oregon, for example, legislators looked at Portugal and passed a law in 2020 decriminalizing all drugs and allocating millions of dollars for harm reduction. The experiment was shut down in 2024 after Oregon recorded a 1,500% increase in overdose deaths since the beginning of the policy, the steepest increase ever recorded in the state.
Some of the increases that we saw in drug use in Oregon that were really about COVID, and also a recent study came out pointing out that fentanyl swept across the US and swept across Oregon right as this policy went into effect. Statistically, this was much more related to fentanyl than it was to the drug policy taking place.
In Europe, the Czech Republic and the Netherlands have implemented decriminalization to a certain degree. But to this day, Portugal remains the only country in the world to have decriminalized all drugs.
I think that the reason that maybe more countries have not adopted whole-scale changes the way that Portugal has is a political decision. There's a difference between a solution to a problem that has political success versus a solution to a problem that has demonstrable positive healthcare outcomes.
Sem dúvida que a criminalização não ajuda ninguém. Não ajuda as pessoas que consomem e eu acho que também não ajuda a sociedade como um todo.
I lost a decade in drugs. It will be a process until the rest of life. Because now I know that life is like this. You cannot stop, never. You just search for the next target and search for the next song.